will record. So from the CARES side, while we're waiting for everyone to get on to get in the meat of the matter, Asia Blissett will be doing our presentation today. She is our senior funding analyst at CARES, and I think many of you know her because of vouchering and monitoring. I'm, of course, on the call. I'm Kirsten. I'm the Director of Grants and Operations. We also have our Planning Director, Kelsey Addy, and I don't know if anyone else from CARES is on. I think Sam may be here as well, who's the Community Rep for Schenectady. And as had mentioned, we have Elizabeth, we have Patrice, we have Jill, Marianne. Am I missing anyone from HUD that hopped on?
Hi, Jennifer Beltree's here.
Hi, Jennifer.
Hello.
So I would say, and we also have the city reps as well. I saw Charles hop on, and I saw from City of Troy, and I saw Sylvia as well. So if we have any city specific questions at the end for the grantee, I don't want to put you guys on the spot, but they are here. So with that being said, everyone, if you started in the chat, just say hey to everyone, really appreciate it. And Asia, I will kick it off to you and I will stop talking.
Thank you for that, Kristen. So I want to thank everyone for taking the time to attend today's meeting. We really do appreciate it. And we're hoping that this presentation clarifies any questions that you may have about spending down ESG CV funds. Like Kristen said, we'll have time at the end to answer any questions that come up. We do plan on, of course it's being recorded, so hopefully we can put it on the website later, but we do plan on sending out this PowerPoint because you'll notice there's going to be some links embedded in it that'll be useful to you. So we want you to have that copy. So the goals of our meeting today, we're hoping to, like I said, reiterate our spending, but specifically the spending during a moratorium. And then HUD also came out with some new eligible costs that we're going to cover as well. So the moratorium end dates, of course, there's two. So we have the New York State moratorium that ends next Tuesday. And there is a part in there about a financial hardship that was struck down by the courts. So we're seeking clarification on that, but what we're reading it as in New York State, families claiming financial hardship that's unrelated to COVID-19, we're thinking they can use prevention funds.
Hey, Asia,
yes.
Sorry, can you speak up just a little bit so everyone can hear? This is really important stuff, so I don't want them to miss out.
Yeah, let me try without headphones. I wonder if that would help. Let me see, is that audio a little bit better?
I'm going to go by the chat, but it's better on my end, so I would assume everyone else's as well. Perfect.
Okay, great.
Yes, sorry.
Please let me know because I've had some audio issues. So to go back to the New York State moratorium, there is a part in there that the financial hardship part was struck down by the courts. And so we're reading into that as if there's hardship that's unrelated to COVID-19, that prevention funds should be able to be utilized if the community is not covered by the CDC moratorium. So the CDC moratorium, that ends October 3rd. And it doesn't apply if a community does not have high or substantial transmission of COVID-19. So another way to say that is if your clients are coming from a place with low or moderate transmission, then this moratorium won't apply and they're kind of left without protection. So now we're talking about vulnerable clients. There is a link that we have here. So again, you'll have access to this and it leads to the CDC site where you can monitor the status of your community to know like what the level is. Is it low, is it moderate, or is it now protected in that high or substantial zone? So the moratorium restrictions on ESG CV spending, the funds, they can't be used to pay rent or back rent except in certain situations, and we're going to cover that later, because a client can't be evicted due to non-payment of rent. So they're not at risk of homelessness. They also cannot be used to pay for utilities or utility arrears. And by utilities, I'm using the regulation definition of gas, electric, water, and sewage. Because I know in New York State, at least, the clients can self-certify to the utility companies to protect their accounts from shut-off. So if it's the same for CDC, it's that same scenario of, if they're not going to lose utilities and there's no point using these funds to keep them on because they're going to be on regardless. So now let's talk about the clients that are eligible. There's a few parts to this that they have to meet. So they have to have an income that's below that very low income threshold for the area. They should not have access to a support network or a sufficient resource. And recall that HUD is counting this moratorium as a resource. It's something that's going to prevent them from being evicted. And then they can either meet one of these two definitions. So either meet the at-risk definition or meet the homeless definition, and not the whole homeless definition, but only paragraphs 2, 3, and 4. So in paragraph 2, that's describing where the residents will be lost within 14 days. But then if you look later in the regulations, the evidence you need for that is a court order. So of course, if there's an eviction moratorium, assuming you can't get that court order, they wouldn't be eligible for assistance with this one. Also, families or unaccompanied youth, families with those youth, could be meeting that homeless definition and fleeing domestic violence as well. So one of those, homeless or the at-risk, and then these funds are really meant to help clients regain stability in their current housing or move into permanent housing. So that's a key part as well. And those two definitions I was talking about, homeless and at risk, that can be found in the ESG regulations, the 576.2, if you're wanting to get more of those details. So the big question, am I allowed to use prevention funding during the eviction moratorium? And really, of course, it depends. So if someone would be at risk of eviction, but they're covered by the moratorium, then we know they're not at risk of homelessness, so they shouldn't be receiving the ESGCV prevention assistance. If someone is at risk of eviction, even though it's covered by the moratorium, so a landlord is still trying to evict them, even though they shouldn't be, then prevention funding could be used to provide legal or case management assistance. But agencies should document the circumstances that make the client at risk. And also document why the clients are eligible at this time. So I'm going to expand on that a little bit more. So if that owner or a court even orders the eviction and it appears to be in violation, in those circumstances, providers are encouraged to pursue some other options first. So connect with the landlords, try to explain the terms of the eviction moratorium. Build that relationship with them, enlisting any legal services. We really want you to reach out to us and we'll coordinate with the cities as well, or the grantee, because our goal is to let the field office know. We want their guidance and we want to let them know what's going on if a landlord is trying to violate this eviction moratorium. And then the last resort is to use a financial or rental assistance there. So back to our it depends. We covered these first two. So now this last scenario, if someone isn't covered by the moratorium, they are still at risk. Now we can talk about being eligible for these funds. So the financial assistance that can be provided without an eviction notice, that can be for clients who are doubled up. So that means living in someone else's home, multiple moves. So if you're moving 2 or more times in the last 60 days, clients who are paying for their own hotels or motel rooms, overcrowded housing, and there's a specific definition to that, 2 or more people living in a single room occupancy, exiting a publicly funded institution, so jail, prison, a psychiatric hospital, and then other situations of housing instability identified by the recipient's consolidated plan or maybe by your city's written standards. And so we get also to this 14 or 21 days notice. So remember, the 14 days is for the homeless definition, and that one requires a court order. But the 21 days is for the at-risk definition. And so that can be another type of notice. So when I read that, I'm thinking like maybe a lease non-renewal or a lease violation, something that's in writing that says the tenant has no more right to occupy that housing in the next 21 days. And so there's a little catch to that too, though. in that 21-day document, if there's language in there that gives them a way to avoid eviction, like, hey, just pay this fee or pay this balance, and the client has the ability to pay that balance, then they're not really at risk of losing their housing. So you'll just have to look at that language. And then also, any clients can still be at risk for causes that are not covered by the eviction moratorium, like maybe nuisance eviction. And we encourage intake staff to work with clients to get that third-party documentation. The ESG regulations, Part 500 specifically, really goes into the documentation need for if a client is homeless or either at risk of being homeless, the steps that you need to take and the order that HUD wants to get either the third-party documentation, and if you can't get it, then certify your efforts, on and on. So there's a lot of good information there. So now that we know who's eligible, we can talk about the actual costs. So the usual prevention costs for case management. So you can use that personnel line in the voucher. Contractual costs. So an example of that might be a moving company, equipment, and these are newer costs here, these examples, PPE, or having that agency-owned furniture that you can lend out to clients, and then your financial and rental costs. So if you're providing rental assistance, we're talking about back rent and rent moving forward for eligible clients, that back rent being up to 6 months of arrears. But we encourage you to check the continuum's written standards for any other limits there. And then we have financial assistance. So rental application fees, moving costs, utility deposits, those types of things. There are some additional activities I want to mention here. The vaccine incentives, hazard pay if your staff is working directly with clients, landlord incentives, so no more than 3 times the rent, furniture and household furnishings, the wireless plan and cell phones that are again lended out to clients. The agency should retain ownership, and then hotels and motels. But we don't want to forget about the other project types, so I'm going to run through those really quickly for shelter outreach and rapid rehousing. So for emergency shelter, almost all of these I think will have case management as an eligible cost, but we have it here: renovation and major rehab, shelter operations, so rent, security, food, equipment, transportation. In the regs, if all of the shelters are full, then you can consider using hotel or motel vouchers. And those additional activities, again, vaccine incentives and hazard pay if you're in direct contact with clients. So street outreach, we have, street outreach, we have case management and engagement, some essential services like meals, blankets, clothes, and toiletries. And clothes and toiletries, that can be a tricky one because that can't be vouchered for with shelters. Transportation and other activities like laundry services, vaccine incentives, hazard pay, hand washing stations, and portable bathrooms. Rapid rehousing, these relocation and stabilization services, so it's case management, but it's also looking for housing and making those connections. Of course, financial and rental assistance, and a lot of the same activities as homeless prevention. So the furniture, wireless plans and cell phones, renter's insurance if it's needed for that client to gain housing, vaccine incentives, hazard pay, and landlord incentives. And so we have them all listed here. Of course, I just broke them down by project type, but I didn't mention training on infectious disease that can be used, I believe, for all project types. And I also want to point out the vaccine ambassadors, and there's a link to more information there, but to spread that information about how to access vaccines. But again, remember to check the continuum's written standards for any limitations. For example, I know that HUD had put out in this new notice that say that 24-month cap of rental assistance in 3 years is waived, but maybe your community does have a cap. So it's encouraged for you to look in both places. And some of the next steps, I know we have meetings set up with a few of you out there, depending on your community, because HUD does have those thresholds to spend the 20% by the end of September, which is coming up, 80% by the end of March. And so if we don't hit those thresholds, we want to make sure that those HUDs aren't at risk of being recaptured. And so if you already have in mind, like, oh, I could use more funds in my shelter, but I'm not spending it in prevention or rapid rehousing right now, consider that in these upcoming discussions, or even moving things between lines. Like if you have a budget mod that you're thinking about sending, and that can help you spend more or use these funds, go ahead and send it my way. And we can continue that conversation of where to place funds, because they can always be moved back. So we want to open those conversations as well. And so I'm going to open it up for some questions. But before I do that, I wanted to start with a few that have already been sent in, so we can address those. And I want to invite our HUD reps to comment on any of them. So there's 3 here. The first one, there's a question of, is there any possibility that September 2022 deadline to spend all of the ESG CV funds, could that be extended?
Hi, Asia. Thank you. Great job, first of all, and hello to all of you, and thank you for including HUD. So I wanted to make sure that you knew you had like the full court press of HUD. We invited our colleagues from HUD headquarters as well, so we didn't introduce them in the beginning, but we are joined by Aaron de Blasio and Jennifer Baylance today too. So welcome to them, and thanks to them for coming up to upstate New York with us. So the answer to that is no. At this point, HUD is not negotiating the expenditure date. As you know, we keep sort of rethinking and trying to do what's best given the circumstances, but those spending dates aren't part of what has been negotiated to date. So what we do want to make sure, and your communities represented today that I'm aware of, Albany, Schenectady, and Troy are doing pretty good. Albany has met their first milestone of spending for September 30th. So kudos Albany and their partners. Troy and Schenectady still have a bit to go, but not a ton. So we want to make sure a couple things are in place. One is that you are doing vouchers. Anything that you have incurred expenses for, you do draw down. And 2, any programs that are ready to go, you implement them as quickly as possible so you meet that deadline. Having said that, if there's any challenges and folks think they aren't going to make 20% by September 30th, please call your rep. Your reps are on the line today. You can IM them through the chat and set up a meeting if you want, but we want to know if you think you're not going to make that deadline and be able to work with you. We're interested in helping these communities get these dollars to the most needy and vulnerable populations. So our goal isn't to take it back. Our goal is to help you problem solve to get it expended. But September 22 doesn't look at this point like we're going to extend that. So keep your programs on track.
And thank you so much.
Pivot if needed. That pivot you mentioned, changing things. That pivoting is, I think, what we've all learned during COVID, right? Like the idea when we started this of what our needs would be and how long these moratoriums that we never anticipated being extended for so long would look. We have to make changes, and there are a lot of eligible expenses within ESG CV that can be done outside of the homeless prevention and eviction piece. And so we really encourage you to look at those needs and how you can address them, and then look to other resources like CDBG CV or the ERAP funds for back rent.
Awesome. Thank you so much for that, Jill. So the second question that came in, there were some agencies concerned with the feasibility of owning cell phones and lending them to clients. They're worried about maybe data overages, and then collecting them at the end of the grants. Is there anything HUD can recommend to make this a bit easier on nonprofits?
Well, I think the model that we're seeing are prepaid plans so that you aren't having a lot of overrun. So there's a limitation on the amount of exposure for agencies when you loan out a phone. This is going to be a realistic or, real challenge how you're going to get these phones back. But I think, we're seeing lots of written agreements that, agencies are signing with their clients to say, this is our phone. You will bring it in for a, check so we see it. Can't be used for lots of personal calls because you only have this many minutes. We want to use it for conducting business to ensure that you are housed. So we want you to take as best precautions as you can. Limiting cost overruns by having prepaid plans is the one way we have seen people be able to manage that.
Good idea. Thank you. And then one of the last questions I have here. So if furniture and household furnishings, if they're purchased with ESGCV funding, do those items need to be returned to the agency at the end of the grant or end of the assistance to the client, whichever comes first? Do you have any recommendations for agencies that don't have storage space or that lease their office space? What do they do about that furniture situation?
Yeah, you need to make some friends with warehouses, right? I think there are a number of programs that have furniture storage program. I'm thinking of like the TOM program in Troy and the Habitat project in Albany that might have the restore, so that there are some options for this. This is a new model where you might be loaning out furniture for lease up. In the past, you've probably suited up an apartment and then leased it. So we realize that this caveat has been challenging for agencies to say, no, wait, we need all that back, that you may not want it back depending on the condition and how you're going to manage it. So please use, the most common sense approach and know that it, right now the guidance is it should be returned to the agency. If you're using HUD funds, that's an asset. We are looking at this. Jennifer, I don't know if you want to join this conversation, but we're trying to look at what that market value for $5,000, which is a HUD financial requirement from OMB, overlaying the CV, ESG CV regs. So what it means in terms of disposing of an asset. So we're still trying to figure that out to make this practical for grantees across the country. But as of right now, the furniture should remain as an asset to your organizations and be returned. But stay tuned as this one evolves like so much. But I invite Jennifer Balance, if she wants to add to that explanation, to join me.
Oh, okay, yes. Hi, everyone. This is Jennifer. At the moment, I would just suggest that everyone might maybe try to hold on to it because we're still finalizing how to dispose of the equipment, and we don't want to give the wrong instructions. But we just want to make sure everyone keeps maybe the value of the information of the property that was obtained. So you keep all the receipts, just so we can make sure if it's either under $5,000 market value or over $5,000 market value, that we're able to direct you in the correct way to dispose of it. So I guess this one is more of a to be determined. And as soon as we have the information, we'll definitely put it out.
Thanks, Jennifer.
Thank you for that. I see Nancy, I believe you have a question as well.
Not a question, but Asia, I'm wondering if we could do the full gallery view during this time. If you're done with the PowerPoint, would that be doable so we can see each other?
Absolutely. Yeah, let me stop sharing here.
Thank you.
Yeah, and thanks to the folks who are chatting about some of the programs. Liz from Hattis and Kevin chimed in about some, I think, of the furniture options that you have too. So one of the things that we appreciate so much about you all in the Capital District is that you are innovative and entrepreneurial and you solve problems collectively so well. So I'm sure the chat will answer all the questions. You didn't even need us.
I have more questions too that have been rolling in. If you're okay with me, just keep them going, Jill.
Absolutely. And you guys sent me a couple in advance too, I think, about maybe you covered all those already. I wanted to make sure I didn't neglect anything.
I have those listed too. So the ones, let's see, about the financial hardship that was struck down, just offering the HUD's perspective on how to kind of deal with that, please.
Yeah, so one, we aren't experts in this court decision yet. So I want to add that disclaimer and invite my colleagues who may be more familiar with me to jump in. But the CDC eviction moratorium, which HUD has partnered with the CDC, that doesn't have the same requirement as the Safe Harbor Act from New York State did. And so there was the slight difference in the law there that the Supreme Court struck from the New York State piece. So having said that, I think even without having to have the financial hardship documentation going into court, I think what we're anticipating is now that New York State moratorium is ending soon, there will be this rush to the court. And I think the folks that we're concerned are going to be most vulnerable are the folks that were queued up to be evicted in local housing courts just prior to COVID, right? I think because you all know eviction takes a long time to work through the courts, but those cases are probably at the head of the line. And they may have been vulnerable to be evicted prior to COVID, independent of any tie back, as we've been calling it, to the financial hardship during COVID. So as you're working your caseload, I would try to identify anybody who had those very early, January, February, early March eviction notices before all of this, because those are the ones that are going to get through my prediction. Those are the ones that are going to hit the court dockets first. And so they would probably be most vulnerable to homelessness right away. So I think managing your caseload there will be helpful of looking at where those are in that process. But bear in mind that there are a lot of other resources that have been put in place to help with back rent. And I know some of them have taken some time to roll out, but I think you've all heard us stress this over and over again. ESG probably isn't the first stop here. We really are hopeful that ERAP will be the first stop to help families who have eviction notices. One, it's well funded. Two, the system is set up. I don't know if all your communities are going through the state or you have your own ERAP allocations to allocate locally, but that money has fewer strings attached, I guess, to get out more quickly, including it doesn't require the eviction prevention, and nor does CDBG-CV. So for those of you that have set up rental assistance programs in your communities with CDBG-CV, the test isn't an eviction notice, the test is income and need. And so you have the ability to mix and match and when folks come in, triage what's the best source for them.
And the other thing is to keep your eyes and ears open, because the legislature may work with our new governor. There's been interest expressed to do something about the moratorium. So that may be adjusted.
Yeah, and she actually mentioned that in her remarks, I think, right away, to say, we want to get this case right.
Thank you both. Let's see. So the next question that we had posed earlier, and I know there are some popping up in the chat, I have those recorded to go down as well. So under the New York State moratorium, the utilities are protected from shut off. Do we know if this is true for the CDC moratorium as well?
No.
We don't, no, it's not, or no, we don't know. Sorry.
No, sorry. Yeah, no. No, we don't know. No, the CDC piece did not cover the.
Thank you. So then we talked about the furniture already. And so since the New York State moratorium ends on 8/31 right now, are we considered to be in the 14 to 21 day window for prevention spending?
Absolutely.
Thank you. Let's see. Would you all be able to discuss when communities could use funds for coordinated entry under ESG-CV?
I'm sorry, Kristen Ford, what was it?
For coordinated entry under ESG-CV.
Yeah, that wasn't eligible. You could use coordinated entry as part of it, as part of this process. We encouraged communities certainly to do that, to make sure that you're following your local plans and standards. You all have good written protocols for your plan, your written standards. And so absolutely, I think one of the things that we add to that is revisiting some of the coordinated entry to make sure you have all the right players at the door. If your system has multiple places to enter and folks are going somewhere that isn't in one of those, identified, how are you capturing people that may have not entered the system before? We know that there are a lot of first time eviction notices for folks that haven't gone down this path. And so one, making sure that your coordinated entry system recognizes that, and revisiting it to make sure it has an eye towards equity. HUD has really been stressing equity as part of how these funds are distributed, how people are brought into our continuum networks that perhaps weren't fully engaged before. And so please consider that as part of it. But coordinated entry should absolutely be utilized during this process. And to that point, also HMIS. So the cities that receive the ESG CDBG funds can allocate resources towards the HMIS systems as well. So this is an opportunity for some data tracking and evaluation during this time that you can deploy to both report and understand homelessness maybe a little more in your community during a pandemic.
Excellent. Thank you, Jill. Let's see. This is a long one. Let me see if I can say it the right way. Can we use prevention financial assistance funds if a person does not qualify for CDC moratorium protection? For example, someone trying to make timely partial payments that are as close to the possible full payment, and they're trying to get government assistance to cover rent, but maybe not necessarily have gotten the full amount to pay the landlord in full.
So could you use ESG CV for that?
This
Yeah.
is the question.
The test is, are they at imminent risk of homelessness, right? So the test for ESG is a homeless status, compared to, the ERAP test, which is income based. So that's the triage part of this. That's why coordinated entry is so critical, right? For you to get folks into the system and determine what is the best resource. I'm not sure if I answered your question. I didn't. Okay, Wendy's saying I swung and missed.
Feel free to speak up, Wendy.
Okay. So my question, Jill, was you said earlier that as long as the CDC moratorium is in place, that's considered a resource, as the New York State hardship declaration used to be considered a resource before it got struck down. And there are people who do not qualify, and I would never tell to actually assert their rights under the CDC moratorium. The statement that they must make is that they have done my best to make timely partial payments that are as close as possible to full payment, and to get government assistance in making my rent or housing payments. For many people, that's a hard thing to say, and probably not something they can say under penalty of perjury. So my question is, if somebody waltzes in the door today with a notice from their landlord or illegal other conduct by their landlord, and I determine, or they tell me they cannot make that declaration, can we use prevention financial assistance to help them, particularly to move if ERAP isn't available?
Well, rapid rehousing sounds like it's an option there. I have some colleagues on the phone. I think Marlise Grogan, I think you've joined us as well. And if you want to jump in here with, how we're seeing that play out across the country, I'd welcome you to bail me out of that one.
And Jill, if you could explain how it's rapid rehousing, because they're sitting in their house and they're trying to potentially move and or stay put, and they're getting taken to court or give notices from their landlord. So they're I feel like they're in prevention land to me.
Okay.
And so the question is, they're housed, no help from New York State, can the CDC, and they can't use the CDC moratorium, are they good to go in terms of prevention financial assistance?
If they are not covered by a New York State eviction moratorium or the CDC eviction moratorium, and that gets a little tricky depending on whether you're in a county with a high case count or not. But if both of the eviction moratoria do not play in and they're not covered, then you would still need to go through the ESG homelessness prevention eligibility, which is what you were getting at, Jill, meaning like, are they at imminent risk of eviction? So are they within 14 or 21 days of eviction? So for the 14-day test, are they actually going to be removed from their unit within 14 days? For the 21-day test, have they gotten notification that their right to occupy the housing is being lost within 21 days? In addition to that, they would also need to meet the income test. So now it's 50% AMI, annual income of 50% AMI if you're using ESG CV, or annual funds for COVID response. And then no resources and support networks. So if you have someone who's actually like in their housing, they're able to make payments. It's like what Jill was saying about triage and coordinated entry is really, really important, because you do want to make sure that you're focusing your ESG funds on those who are most likely to actually become homeless. And what we know from research is that people who are doubled up in other at-risk situations are much more likely to become homeless than those who are actually like making some sort of payments. Maybe there's room to negotiate with a landlord. It sounds like in the case you presented, Wendy, that may not be the case. So they may actually be in a 14-day or 21-day position for actually getting kicked out of the unit. And in that case, they also have the income. They also have no other resources and support networks you could serve them with homelessness prevention. In all cases, though, we would really want to encourage folks to use ERAP before ESG homelessness prevention, because you can't, we've got a lot of ESG CV money. We could target it for rapid rehousing. Not something you necessarily can do with ERAP, and ERAP's a lot more flexible when it comes to eviction prevention. So those are just some food for thought.
Yeah, the issue around ERAP is the staying. And that's kind of the issue about that.
What is the issue, Wendy?
That people need to stay put.
Oh.
So for somebody who says it's broken, the relationship doesn't work anymore, I can't make the monthly payments, and I'm going to get put out, that's the problem with ERAP. Is if things open up and more housing is available and people start to move as opposed to hunker down and hold on as tight as they can, then I think the prevention money has a role to play with ERAP for people who it's not going to work to stay and use ERAP to stay.
I think in those scenarios, we'd want you to document that case really well. I mean, if you have a circumstance where, there's household violence and someone needs to relocate, and they, the victim needs to be put into a different unit, and you found a safe unit that they can afford or get assistance for, I think document your case. Again, we're in a pandemic. We want people safely housed to the extent we know there's also a market problem right now that we haven't had turnover. So there isn't a lot of places to move. And so people may have been staying put when it's not the best scenario. Document those cases. And when you have those ones that are unusual, let us know. We want to make sure, some of those may be a CDBG CV case instead of an ESG, but I can't, Marlisa is right on the money. ERAP is really why we want you to go first. There's a lot of money that has to be spent by a certain time, so we need to use that. And there are so many other homeless needs during this time that if you're parking a bunch of money in eviction prevention funds or rental assistance funds with ESG, still talk to us, because we want to help you do an amendment to pivot. And not to say that you can't put any money there, but it may not be what we like to think of as the highest and best use.
Thanks,
Great.
Jill. Thanks, Marlisa. That was a good one. So that being said, thank you again, Wendy. Back to coordinated entry. Per our most recent coordinated entry review, agencies have been advised that the definition of all available resources being expended is being interpreted to mean that all clients seeking ESG and ESG CV assistance must first apply for and receive a determination on ERAP before agencies can use the funds for rental arrears. Is this the case? If not, can assistance be sent, I'm assuming, to the client after the moratorium ends?
So you're saying that people need an ERAP denial to be able to get ESG assistance?
That's how I'm interpreting the question to read. If they need to see, like if someone gets denied for ERAP, then they can explore the ESG CV, ESG options, or can both be applied for at the same time.
Well, I think this is a encouragement as opposed to a must. Again, we don't have what the ESG requirement, and again, HUD colleagues jump in here. We're looking at your support network and other available resources as part of that intake determination, but there isn't a specific rule that says you have to have an ERAP, rejection letter to be able to queue up for ESG's CV or ESG in general for that matter.
I see. Thank you, Jill. And then the
but
one
I am, punting on that one. So I invite my colleagues to correct me if I'm wrong.
Anyone else from HUD? I saw
No,
Marlisa
that
on
sounds
mute.
right to me. That sounds
Okay.
right on to me.
Thank you both. Same vein, CE, what line could CE be funded under within ESG CV? So if we redo budgets, we kind of pivot like you've been saying, where would coordinated entry go? And yeah, that's the question.
And I'm curious because there's a line of questions here. Is there insufficient coordinated entry budgets? Is that where this is coming from? Are folks running out of coordinated entry money in their regular ESG funds? I'm sorry, I'm not in the chat to see what the genesis of that question is.
Oh, that's okay. Just one of the coordinated entry providers want to speak up. I know we have some of them on the phone, if not all of them, or cares. Kelsey, I don't know if you have anything you want to add.
That's a good question, Jill. I mean, I think our coordinated entries in the communities that we're discussing at this time, Rensselaer, Schenectady, and Albany, they're funded through COC, not through ESG. But Kevin, I see you have unmuted. I'll turn it over to you.
Yeah, so we've been doing a heck of a lot more work in prevention right now, setting up the prevention for coordinated entry, as well as we've taken on the new EHV vouchers that we have a coordination with our local public housing authorities. A lot more work there, a lot more hours. And I think arguably these are all COVID related. So the question is there a possibility of more funding? And if so, what line would that be coming from?
I think we'd have to take a look at your budget and see where it's in now. If the community has put that as a intended use when they put in their ESG amendment to HUD, their CV amendment, and see if it's a line included. If it is, then you could certainly proceed. And if it's not, we could look at their budgets just to see where that would fit in. I'm not as familiar with the Capital District's ESG CV budget. So I think, I don't know if Elizabeth or Jen might have a better sense of that than me. But it's probably. Oh. And Marlisa's reminding me that where HUD, where the notice said you could do it is under street outreach. So if you don't have a street outreach line in there now, that could be added, funds could be reallocated to so that you can put coordinated entry in there.
Now, from that perspective, like a contracting / IDIS perspective, we just ask to add a coordinated entry line to the plan, or would it fall in under a different category?
Well, each of the cities submitted a budget plan to HUD of how they were going to use these dollars. And it's not necessarily a line item budget, but a categorical budget is how ESG works. So you tell us you're going to do street outreach, prevention, rapid, etc. And so if you didn't have a street outreach line and you need to add that to accommodate additional coordinated entry, which sounds perfectly reasonable, that would require a budget amendment. And so the cities would have to jump through the hoops to send that into HUD. We're trying to get to this stage of what we're calling no drama amendments. So it's not such a big whoop to move this money around so people can be nimble. But it does require a few bureaucratic hoops. So you need to, the cities would need to look at that in their budget and amend accordingly. And
Thank you, Jill.
It's not a big lift or a ton of paperwork. I mean, like this is going into IDIS and letting us know, and we can go in and review it and approve it reasonably quickly.
That makes sense. Thank you. Let me see. So Kevin, I know you had asked about the Code Blue, and I have your answer. That Code Blue money for the state, the OTDA contracts, does in fact count towards the milestones that have been established. That was all the questions that people had sent in the chat. I'm not sure if we want to open it up if anyone else has anything they're really hanging on to and they want to speak up. I mean, if everyone's good. I would say by the crickets that I'm hearing, everyone is probably all set. As you all know, we're here. The grantees are here. We're happy to kind of navigate whatever situations may come up, be a sounding board, you know. So thank you very much for coming today. I don't know if any of my colleagues or HUD wants to say anything.
Just thank you for inviting us today, and you know, on behalf of all of HUD, I mean, we just continue to be blown away. I know we try to say we appreciate your work all the time and thank you, but you guys just keep kicking butt and doing this hard work during challenging circumstances, and we're in awe of how you've been handling all of this over the past year and a half. So thank you more than anything. Thank you guys for continuing to do this work and continuing to present us with really good questions that we bring back to HUD and to the policy side of this to say, you know, how can we make this better? How can we help these groups address homelessness during these unprecedented times? So keep the good ideas and questions coming, and we will try to keep responding in that way. So thank you all very much for inviting us and having us today.
Thank you for coming. I do want to give a quick shout out, thank you, to our furniture banks in the area. So we have Hadis's Furniture Bank in Albany, and we have Donna and her team in Troy, Rensselaer. So just so you all know, they had brought it up in the chat, but if you want to talk to someone about the furniture situation, they're your go-tos in those two. I don't know who would be the go-to in Schenectady. I apologize. So thank you guys so much again. If there is anything, like I said, we can do, please feel free to email us. Thank you again to HUD. And keep on going on, everyone. Thank you, Asia. That was a great presentation.
Thank you, everyone.
Have a great day, everyone.